Welcome to Cells to Symptoms, the case-based way of learning pathology. We've previously discussed the process of Atheroma. Let's now consider the complications of this process and its manifestations clinically. You'll remember we have a basic arterial wall, which includes the outermost layer, the tunica adventitia, the middle layer, shown here, including the elastic laminae as a zigzag line, and the innermost layer, the tunica intima. Also, you'll recall that an established fibrofatty plaque of atheromatous disease contains an abundant amount of lipid, which is both intra and extracellular, with a local collagenous and fibrotic response, which distorts the lining, causing abnormal flow. So what complications then can arise from this process? Well, firstly, we can imagine that the fibrofatty plaque can continue to grow and extend and intrude into the lumen of the vessel, reducing flow of blood ever more severely. This reduction in flow leads to so-called ischemia of the tissues, that is, an inadequacy of blood supply to meet its metabolic demand. Eventually, the flow may reach such a critically low level that the tissues now show irreversible damage, and that is, we move from ischemia to infarction. So this narrowing of the vessel we can describe as either being stenosis, that is severe reduction in the lumen, or complete occlusion, when the vessel is, to all intents and purposes, blocked. Secondly, let's consider the fact that the intima becomes distorted as the plaque progresses, leading to surface ulceration, and this promotes surface thrombosis. So thrombus now forms within the vessel lumen from the constituents of blood, which only serves to further decrease the lumen of the vessel. This surface thrombosis may also become detached and travel elsewhere in the circulatory system, a process known as embolism. So secondly, we have the possibilities of thrombosis and embolism. A further complication to consider is that the atheromatous plaque itself becomes unstable. It's maybe useful to just note that the term atheroma comes from the Greek atheros, meaning porridge-like, which describes quite graphically the fact that an atheromatous plaque is quite greasy and gunky and unstable in nature. And sometimes within the plaque, hemorrhage may occur, which will rapidly expand the size of the plaque, again reducing vessel lumen. So plaque rupture is a third complication to consider. One can imagine that as this rupture occurs, often some of the atheromatous debris itself will be exposed to the vessel lumen and shower into the lumen and distally, causing atheromatous debris itself to embolize with possible complications. Although atheromatous disease begins as an intimal process, as the plaque progresses, gradually it will begin to intrude into other layers of the vessel wall, and the media becomes affected. This weakens the elastic fibers within the vessel wall at that point, and so the vessel may then begin to dilate, a process known as aneurysm formation. With this progressing lesion and weakening of the medial layer, including the elastic fibers, blood may sometimes track under the intima and begin to split the vessel wall. This split will often lift the intima on one side, together with part of the media, from the remaining media and the adventitia on the other side. This splitting of the vessel wall is sometimes described as a dissecting aneurysm. In this video, we've discussed the complications of atheroma. You may wish to view a previous video in which we discuss the basic idea behind this process. Thank you for watching this video. We hope you found it both interesting and informative.